today is last day of April already, huh? Jeez. So it's just, I don't know. And okay, last week we was talking about thyroid, hypothyroidism. It's very important for the especially women over 40, 50s, and I didn't really finish last time, that video. You guys want me continuous to do it or just doing something else? Any suggestions to have another symptoms and another disease? No? Okay, then maybe that one is, we had enough to video what we did. No questions? Thyroid? Yeah. The old, other symptoms, other disease is very important, but especially thyroid is, and you cannot really compare, the usual, I'm tired, I couldn't sleep, and then I'm sort of lazy, not, concentrate. Those are, they think about just common symptoms, but that's very important. And then the thyroid is a blood test. It came out, whatever, their hormone, T3, T4s, and then, so judge for the thyroid, high or low. So it's, that simply you guys can take the test. And so, something, if you guys all of a sudden, I cannot really sleep good, or, that sometimes I lose my hair too much, compared to normally when you do the shampoo, oh boy, I lose so much hair. And then, that extremely tired, and just, even in the morning, you get up, you had enough sleep, still, oh boy, this morning, last night I have enough sleep, but still tired. That's the question about thyroid, So as I told you, this symptom is more than men. Woman has more than men. So woman, and before or after menopause, and then they say, oh, that's my, menopause symptom. But it's try to have test the thyroid. Okay, so it's today's maybe thyroid is, that's enough then. Today maybe stroke. Stroke. When we walk to the street, the people, and just, and some have, they couldn't walk well, or, sometimes it's, the face. And stroke is, we have lots of reasons, can be stroke. And I'm sure that high cholesterol, high blood pressures, and all different, that's sort of like a warning you might have. So I have a, here video, and then the stroke, and then from there, I will explain to you guys. And
My name is Chip, and I'm a paramedic instructor for the state of North Carolina. I want to talk briefly on how to identify someone that's having a stroke. Hello, my name is Chip, and I'm a paramedic instructor for the state of North Carolina. I want to talk briefly on how to identify someone that's having a stroke. Stroke can be caused by several things. Either way, it's an interruption of blood flow to parts of the brain. What happens is some of the first things is initial weakness. The patient gets very weak. They can be confused. And they'll typically lose control of at least one side of their body. When that happens, you might see an obvious drooping to one side. One good test is have them smile, and if they smile and one side can't go up and match the other, it'll droop. They might have a little drooping on one of their eyes. That's all indication of a stroke. Another thing you can do is you can ask them to hold their hands out. Anyone should be able to hold their hands straight out and maintain that muscle tone. The person that's having a stroke, that one weak side will slowly drip down. And again, that's yet another clue that they're having a stroke. With that in mind, definitely 911 is very important. It should be called as soon as you think they're having a stroke. Don't delay at all. There are certain time requirements to give certain treatments for stroke patients. There are national stroke initiatives which have certain target time frame goals to get these patients into certain stroke hospitals so they can get the best treatment possible and hopefully have a recoverable outcome and get some function back from that side. And this has been basic stroke identification.
Doc, so I try to.
Hello, my name is Chip and I'm a paramedic instructor for the state of North Carolina. I want to talk briefly on how to identify someone that's having a stroke. Stroke goes to parts of the brain. What happens is some of the first things is initial weakness. The patient gets very weak, they can be confused, and they'll typically lose control of at least one side of their body. When that happens, you might see an obvious drooping to one side. One good test is have them smile, and if they smile and one side can't go up and match the other, it'll droop. They might have a little drooping on one of their eyes. That's all indication of a stroke. Another thing you can do is you can ask them to hold their hands out. Anyone should be able to hold their hands straight out and maintain that muscle tone. The person that's having a stroke, that one weak side will slowly drip down. And again, that's yet another clue that they're having a stroke. With that in mind, definitely 911 is very important. It should be called as soon as you think they're having a stroke. Don't delay at all. There are certain time requirements to give certain treatments for stroke patients. There are national stroke initiatives which have certain target time frame goals to get these patients into certain stroke hospitals so they can get the best treatment possible and hopefully have a recoverable outcome and get some function back from that side. And this has been basic stroke identification. Hello, my name is Chip and I'm a paramedic instructor for the state of North Carolina. I want to talk briefly on how to identify someone that's having a stroke. Weakness, the patient gets very weak, they can be confused, and they'll typically lose control of at least one side of their body. When that happens, you might see an obvious drooping to one side. One good test is have them smile, and if they smile and one side can't go up and match the other, it'll droop. They might have a little drooping on one of their eyes. That's all indication of a stroke. Another thing you can do is you can ask them to hold their hands out. Anyone should be able to hold their hands straight out and maintain that muscle tone. The person that's having a stroke, that one weak side will slowly drip down. And again, that's yet another clue that they're having a stroke. With that in mind, definitely 911 is very important. It should be called as soon as you think they're having a stroke. Don't delay at all. There are certain time requirements to give certain treatments for stroke patients. There are national stroke initiatives which have certain target time frame goals to get these patients into certain stroke hospitals so they can get the best treatment possible and hopefully have a recoverable outcome and get some function back from that side. And this has been basic stroke identification. Hello, my name is Chip and I'm a paramedic instructor for the state of North Carolina. I want to talk briefly on how to identify someone that's having a stroke.
Okay, the stroke, sometimes you cannot, realize when it's coming. So, that feel like you are very weak, and sometimes, that confused, and sometimes, when you talk, you feel not really clear. As he says, when you hold your hand, and one side is weak. So it's our brain is, the halfway, and this side is control. Right side is control is the left side. And then the left side is controlling the right side. So something the brain has not functioned well. So sometimes the high blood pressure is going up. The very capillary tube, the blood vessels is not, going, through, float around well. And so that means, plugged up. And sometimes it's, high cholesterol. person has cholesterol, the little pieces, and then all of a sudden blocking that blood vessels. So, and then, the stroke. And then once, that you have those kind of symptoms, and then it's very hard, and once you have, and then one side is not really using, after something happened, the Western medicine, they just do the, physical therapies and then all those, massage things. But Asian medicine, acupuncture, we just try to do, opening up all the vessels, the energy flowing things. So we having pretty good result with the acupuncture, and sometimes, the herb too. But because once you have that, and all, the muscles twisting that moment, and it's hard to come back. It really takes time. So maybe, that they say, so within 3 days, if you guys treating, it's gonna be really, that the good success, successfully, and it's coming back. But after, 1 week, 2 weeks, and then, 1 month, it's already your muscle is, the firming that side. So it's hard to even, you do the physical therapy and all the treatment. It's hard to, correct the right way. So right after that, when something, sure, you go to 911, still, they cannot really do anything. Right? So sometimes, blocking the clot. Blood is blocking the brain vessels. Sometimes they have to, that you can be the coma. So you have to have surgery, brain surgery or whatever. If it's not that bad, and maybe, they just give you, aspirin or heparinize, blood go through, the little vessels. So, and so once you have that stroke, it's hard to, the correction. This one is, I think that he's the paramedic person to talking about the strokes. And then this person is not the healthcare provider, the special thing. And then this one is more like, that the
6 warning signs a stroke is coming. Cerebral stroke is a leading cause of serious disability in the U.S. at the moment. Each year, thousands of people suffer from it, and a lot of them are first-timers. Thankfully, there are several warning signs to tell you ahead of time that something's not right, so that you can protect yourself. Before you find out what they are, be sure to click that subscribe button and ring the notification bell to join us on the bright side of life. The statistics for this condition are dire, to say the least. According to the Internet Stroke Center, every year almost 800,000 people suffer from stroke, and only for 150,000 of them is it a recurrence. So what exactly happens when you experience a stroke? The most accurate way to describe it is a heart attack for your brain. A cerebral stroke occurs when some parts of the brain get interrupted. As a result, the body can't function normally and needs urgent medical attention to get back to its normal state. The most confusing thing about a stroke is that even though its symptoms usually develop quickly, it can still take hours or even days to notice that something's wrong. However, there are some red flags you should never ignore, no matter how minor they seem at the moment. So let's start with number 1, high blood pressure. High blood pressure is never a good thing. It can lead to a whole bunch of serious problems, including a stroke, because it damages the nerves in your brain and weakens the blood vessels. Apart from that, according to the Mayo Clinic, high blood pressure can result in a clot forming in the bloodstream. If these clots move further to the brain, it can cause a transient ischemic attack. Often called a mini-stroke, this sort of attack is a warning from your system that you have an increased chance of experiencing a full-blown stroke next time around. So be sure to keep your blood pressure in check to minimize any possible risks. Number 2, vision problems. Strokes can affect your eyesight as well. It can cause double vision, blurred vision.
Okay, especially, they say high blood pressure. That's why it's usually over, the high side is over 140. They recommend to take the blood pressure pills. So once you take the blood pressure pills, that's the rest of your life has to take the blood pressure pills. The reason why, once you take it, that your body that automatically cannot control your blood pressure. So, but the Asian medicine, some people says maybe not over 150, you don't have to really take it, but it's, most of doctors recommend over 140, over 90, you have to take that. We never really know what's gonna happen. So the doctor says, you just, holding your palm, and anytime it's gonna be blow out. So you have to take the blood pressure. So, blood pressure, and then you can buy whatever, that just very simply you can measure. If you suspecting you have high blood pressure or whatever, then, they're checking almost every day or sometimes. And then when you have, high blood pressure, you might have some stress. And then you got really mad or angry, and then all of a sudden your blood pressure might go up. So you see now the blood pressure is high, means your vessel is very tiny and narrow. So all of a sudden, and then your blood try to go, push up, it might break up. That's the one of the reason, and that's strokes. So the first thing is the blood pressure. If you have a high blood pressure, think about the stroke and how I can prevent, the stroke from the high blood pressure. The second important thing is,
and even a notable loss of vision in one eye.
Mm-hmm.
A survey conducted in the UK confirmed this too. About 1,300 stroke patients remembered having vision problems before the attack. So whenever you notice that your vision is suddenly changing, contact your doctor as soon as you can. Of course, it could be nothing, but there's still a possibility that your quick reaction will prevent something serious from happening. Number 3, numbness on one side of the body. You've probably heard that numbness or weakness in the face, an arm, or a leg on either side of your body is a common sign of an upcoming stroke. In some cases, you can also expect paralysis on the opposite side of where the stroke.
Yeah, sometimes when you sleep, one side is numb and the other side is okay. But it's when you get up, you're okay. Oh, that's nothing. And then, maybe after 1 month or 2 months, it's coming back again. So that means something, and then notice. So you have to really, be careful. That's what they say. If even you go to the doctor, maybe nothing, but still, that one is very important. Once you have stroke, it's hard to coming back to the normal. So we have to really prevent, and then, the good way. This stress is always, that everything. Cancer or whatever, this one is maybe because of the stress and then all that. That's what they really emphasize for.
Occurred in the brain. Luckily, it's pretty hard not to notice this red flag. It'll allow you to seek help just in time to prevent any irreversible damage. Number 4, dizziness or fatigue without any reason. A study conducted by the School of Public Health at the University of Michigan showed that vertigo and dizziness are one of the most frequent factors among patients who have a stroke. This state of confusion is most likely the result of the affected side of the brain. So, once again, don't assume that it'll go away on its own. Call a doctor and find out what it's all about.
You know, especially vertigo, the dizziness, it's hard to define because of what, the reason. You know, sometimes they say it's ear, you know, the balancing things. And sometimes it's brain. You know, we don't really know that what's the reason. Sometimes it's, you know, the iron level is very low, and sometimes we have dizziness. Especially now, I have dizziness problem, the vertigo. They did all kind of tests. Usually, I don't know, it's they did the MRI on my brain, and then ear, you know, balancing test, I'm okay. And then iron level is okay. All okay, but still I have some the dizziness. And at that time, I have a low blood pressure. And then usually, you know, that 90, 60 over 90, it's under 100, the high side. The doctor gave me that bring it up the blood pressure. And then, you know, he says maybe I have to take the 3 weeks. And I took 2 weeks, no change, so stop. And then, you know, the vertigo and the dizziness problem is all kind, you know, reasons it will bring it. But it's one of the stroke side too, when you have a dizziness, and so you have to really concern. Right now, it's, you know, that I'm much better. Around 4 or 5 years ago, my vertigo problem, I went into the hospital 3 or 4, actually 4 times. I was in the hospital one time, you know, I was in the hospital 2 weeks. Still they couldn't find it. But that time, maybe, you know, if I fall, and then maybe, you know, there's some kind of stroke, right? So, you know, they are not letting me go home. So I was in the hospital around 2 weeks, and then they cannot do anything. The vertigo problem, they just give you what? That seasick pills, like meclizine. And then just keep that pill and make you sleep. Just make you sleep. So that means just take it easy and don't move around. If you fall, you might have, you know, it's a really severe stroke. So they just, you know, they keep you in the bed. But that's not good either. So it's, you know, that when you have some kind of dizziness or vertigo, and then, you know, sometimes your eye is not really clear to looking for that, then the first, you know, sure, they might not find what's wrong, but still you have to check it some ways. You know, old people, and like me, and so many people, you know, that they say, oh, I have a, you know, that dizziness, and here, there. But that's not all for the, you know, the stroke. But still, you know, that one of 1,000 reasons, and one of the death symptoms can be occur to the stroke. So really, you know, careful for that. That's what they say.
Number 5, a sudden migraine or severe headache. Strong headaches and migraines never appear out of thin air. In case of a stroke, it happens simply because the blood flow to the brain is either blocked or cut off due to an interruption in the bloodstream. All these processes provoke a vessel tear that turns into a headache so severe that you can barely cope. Keep in mind.
Yeah, headache. Headache is lots of reasons. Sure, you know that sometimes you eat too much, all of a sudden you eat too much, and you might have some kind of headache. And you didn't sleep good, you might have a headache. And so, but we're not really talking about just, you know, temporarily, or whatever, you know, we have a headache. Just a severe, sometimes it's migraine. Have a headache here and here, sometimes it's in the back and all that. That means, you know, that blood clot is going around, and maybe, you know, that some area, that blood clot blocking, and then that kind of headache. So it's, you know, that just, you know, that a couple of times, oh, I have a headache, and I couldn't sleep well, so I have a headache. those kind of things we are not really concerned. You know, the certain time just come and goes. Those kind, you know, headache. You have to really concern. You know, oh, I just taking the Advil, or just Tylenol, or I'm okay now. And then maybe after a couple of days later, and then I have a headache again, and then take that pills. Don't do just, you know, continuously like that. And then certain time you try, if that one is not go away, has to go to the doctor and check it. And then acupuncture, you know, headache is pretty much, you know, the cure for the headache. So we concern the headache is all different area has different organ related. As I told you, that when you have a stomach trouble and it's not good digestion, you might have a headache right here. And all of a sudden, oh, I got a headache. Sometimes you eat too much in here. Usually in the backside, it's high blood pressure or too much stress. And then side, that one is, that we talk about. This one is all meridian we're talking about, the Asian medicine. So maybe liver function is not good, sometimes we have a headache here. So if you have a migraine here and here, whatever, all go around, you must go to the doctor to check it. Why I have, the headache come and goes all constantly. So that's the reason. And all of a sudden, one of the days, it might, or because of the high blood pressure, you might have a headache. Sometimes low blood pressure might have, headache too. So before I told you, you guys, blood test, complete blood count, and then you should know your average white blood cell count. Even the blood pressure too. Your normal, your average blood pressure is, mine is, 130 over 70 or whatever. And then you have, all of a sudden, you have 140. Still, that's normal range. But for you guys, it is that one is high. Or all of a sudden, it's the low, high side is lower than 100. That's low. My blood pressure is usually 110 over 70. I know that. And then if I have 130, the high side, my blood pressure is already went up. So you guys have to know what your average blood pressure is. Very important.
That this is one of the most obvious signs of a possible stroke, so you definitely shouldn't overlook it. Number 6, stiffness in the neck or shoulder pain. A ruptured blood vessel in the brain can easily cause a stiff neck or shoulder pain. To find out whether it's actually stroke bad or not, try to touch your chest with your chin. If you can't do that at all, even though it's never been a problem before, that's a really bad sign. Consult your doctor immediately and make sure to follow all their recommendations. And these are...
And sometimes, they say it's neck. You cannot really pull it down like this. Or your tongue. Just pull out your tongue and try to touch your upper lip. Some people cannot do it. Like this. Even they try hard, they cannot do it. That's another sign of the stroke. So it's to pull out the tongue and, the lip. Okay, I'm gonna finish up this one. Right now, I had a bad cold, and then Saturday and Sunday, yesterday, I was really take it easy, but still, today, I have some stiffness in my neck. So I don't know, I might leave early today, but it's just, this one is one of the
basically all the must-know signals of an upcoming stroke. But don't go anywhere yet. Just like any other condition, certain groups are at higher risk of having a stroke. And the more of these categories you fall into, the more careful you have to be. According to the National Center for Biotechnology Information, you're more likely to have a stroke if, again, you have high blood pressure, 140/90 or above. You're an older man. Women and younger people have a slightly reduced chance of having a stroke. You smoke. Smoking can affect the amount of oxygen that reaches your brain. It causes an unbelievable amount of damage to your blood vessels and leads to high blood pressure. One more great reason to finally give up this bad habit. You have diabetes. To put it short, this condition is caused by a deficiency of the insulin hormone that regulates your body's blood sugar levels. When there's a lack of insulin in your system, it can't reach the parts of your body where energy is needed, like your brain. You have heart disease. Heart disease provokes blood clots. You already know by now that an interruption of blood flow can leave you one step away from having a stroke.
If you have diabetes symptoms, diabetes, sometimes the sugar is too low. Sugar is too low, and then, the people fainted. When they faint, sometimes they cannot really wake up. That's another kind of stroke. Might bring it to you too. And then heart also. That's what. Very important.
Other risk factors that can get you in trouble include alcohol and drug abuse, obesity, an unhealthy diet, depression, anxiety, and a sedentary lifestyle. All of these things can trigger certain processes in your body that can result in a stroke one way or another. So just pick your menu carefully, exercise regularly, and take care of your mental health by reducing your stress levels. But what should you do if you have a stroke? If it happens and there's no one around to help you, call 911 or your local emergency number. Do not try to drive yourself to the hospital. As you're waiting for an ambulance, don't eat or drink anything. Your system doesn't need even more work right now. And finally, try not to panic. Easier said than done, I know. But if you're under 60 years of age, your chances of survival are pretty high. Your nerves and anxiety, however, will only make the situation worse. If you're supporting a patient, your friend, or just a random person who's having a stroke, make sure to act quickly. Again, your first step is to observe the patient carefully and call 911 or your local emergency number to notify the operator about the situation and the patient's current condition. As you're waiting for an EMS, try to keep the patient on their side so that their head is a bit elevated. They may vomit, so be prepared to support their head in case that happens. And don't forget to speak to them in a calm manner to lower their panic and anxiety. By following these simple steps, you'll provide the best help you can before the ambulance gets there. Do you know any other symptoms of a stroke? Tell us in the comment section below. Remember to give this video a like, share it with your friends.
Okay. This one is more like, that the common sense, what you're supposed to do and all that. But especially, the stroke. And then, what we say, heart attacks. And those are very important time. 1 or 2 minutes after that, somebody might die. So even, you cannot call that 911. But if somebody cannot find it, then you're going to go. So this one is very important. Just, not like you have cancer and then, you can go to the doctor and call a friend or whatever. But it's the stroke is all of a sudden it's happening. It's all the brain work. So it's very important. So it's before, that I was give you guys lectures, good food, good nutrition. And then exercise regularly. And sometimes, you're very tired, you sleep 2, 3 o'clock in the morning, and then you sleep, in the morning, 9, 10 o'clock, sometimes you go to bed. So it's a regular daily life is very important for your body, train that way too. So it's, all the disease, all the symptoms is very important, but it's, like a stroke, the heart attack is just sometimes, just like that, you can go. Or, stroke, even, that you just come back to normal, but still, that your all muscles and bodies is not really like normal path like before. So this one is very important to, that concentrate. Okay, I have. Guys enjoy? Yeah, some of them is really useful at home. So, that little tip is good for you guys, that at home. Sometimes you don't know what to do, but it's really good idea. If that anybody has some idea and to speak here? No? Just share. And I don't know, today I'm not really feeling good, so just, I cannot just do more than what. That anybody can share with us? No? Some, if you guys have some special ideas and, share with us. Yeah, that's maybe, it's really helpful for me and for you guys too. Huh? Okay, then I don't want to have too much thinking and headache, and we have another one. Let me see what we have here. Maybe last time I showed to you. Let's have fun. This one is all Korean, so you guys are looking at me like that. Saving shampoo is not too much. Yeah, I use this in the bathroom. Okay, make shiny. That's especially whatever you're not using that toothpaste, make real shine. And then even in your car, around the light or the metal things, it's gonna be really shine. And then stain removed too. This one is the drain plugged up, and then vinegar, and sometimes we use Coca-Cola too. It's better than Drano, expensive chemical stuff. That's so that this one is much better. toilet cleanser, sometimes it's not really working, but Coca-Cola or Pepsi is best one. Yeah, that's, that sometimes you are not finished at the Coca-Cola, just save it. And, it's very good. And sometimes, key, you cannot really even open easily, and you just, the spray with the Coca-Cola. Much better than the W40. Yeah. So you see, that way we try to avoid the chemical stuff, the natural things, and this one is all Korean, maybe you guys. This one is the conditioner. I remember I told you guys, don't use too much the shampoo process, the rinse. The rinse is worse than the chemical stuff is worse than shampoo. So if you have extra the rinse, that's make that the grass clean. It's very shiny and very easy to clean too. Sure, the vinegar, we used a lot of, the cleaning, that's wash the vegetable too, but it's, shower head, whatever. We just use the vinegar and then, to make the clean. The vinegar use a lot of different ways. This one is mold. The old apartment is we have so much mold. Sometimes, the cleaning stuff is not really removed well. But this one is. So basically cleaning things, baking soda, and then vinegar. Two things make everything can clean. That the tiles on the floor, and if you use the chemical stuff, it smells or whatever. But it's baking soda and the vinegar is really clean well. And then the price is cheaper too. It's, okay, this one is after that you make the coffee, and then don't throw away. That one is sometimes you put it in under the sink, and then sometimes you put it in the drawer, and then make all that the flame is take away. That's very good. And then not the naphthalene, that you put it in the closet. There. Some of them really time and money and trust had things, that sometimes you handle all the chemical stuff is, coming to the skin. That's not really good. I love to watch those kind of things, that you guys can get from the internet. So many things I use. Maybe one more thing. Let's see what I have here. This. That's, and it's really 1 week, no problem. You know, sometimes the bread, maybe after 3 days, the fresh one is, 1 week is okay, but it's, if you buy some old ones, it's right away, the mold. But it's, if you put the one piece of celery, it's just that's fresh, very good. And then from here, if you buy the lettuce, spinach, or whatever, and then just keep it in the refrigerator. It's not gonna stay long. It's gonna really, but it's you wash it and you put it the paper towel wrapping and then put it in the refrigerator. It's just stay freshness is long time. That's the little tip is useful. Another thing too, sometimes you buy the bag of cookie, you cannot finish right. Maybe after certain days, and then just very hard. And just put it in one piece of bread together. It's very soft until you finish that. Another idea, if you think you cannot finish, that the expired date, 1 week or 10 days, just, the fresh one, you just buy and then put a little bit salt and then shake like this. It's gonna stay double up, not spoil. That's another, usually I cannot really finish even, the one carton. That I buy, and then most of the time when I throw away the half of it, it's already too old. But it's once you open up and put a little bit salt, not too much, it's just stay long. Talking about the banana, sure, you just wrap it, the eggs. But still, if you have a spoiled banana, don't throw away. Don't throw away. And then skin, you just wash it and make the tea. You can have good tea for sleeping. If you make that banana skin tea, you can go to sleep very peacefully. And then inside one is, you think, still that one is spoiled. And maybe save it. And when I don't know that the men can do it or not, but it's, if you put the massage with your hair, and then just, cover maybe 10 to 20 minutes and wash off, it's gonna be really soft and healthy. So it's banana, even spoiled, it's black, and don't throw away. It's really useful. And then as I told you, this one is fresh vegetable. this already. And so wash it, and then it's really wrapping with the. It's gonna be, you know, the long. Even 1 week, it looks like fresh. I think that the Asians using a lot of green onions and so forth, and that, you know, keep it that way so you can. This one is, I don't know, this one is, they says, try to lose tummy, the fat.
안녕하세요, 땅크와. 네, 오늘은 무조건 뱃살 빠지는 운동,
This one is
베스트
for
5
stomach
입니다.
fat. The Koreans, when it's just looking at what they're doing,
오늘
This one is
영상에서는
couples.
땅크와 오드리가 직접 엄선한 뱃살 빼는 데 도움이 되는 5가지 동작들을 소개시켜 드립니다. 서서 진행 가능한 동작들이며 각 30초씩 3세트를 진행합니다. 그럼 바로 시작해 보도록 하겠습니다.
Okay,
하나,
let's start.
둘, 셋, 파이팅! 네, 첫 번째 동작은 스탠딩 바이시클 자세입니다. 양손을 귀 옆에 이렇게 올려주시고 그대로 무릎과 팔꿈치를 교차시켜준다는 느낌으로 셋, 넷, 30초간 진행합니다.
Yeah, this one is, they says, much better than sit-up. Sit-up is, you know, the most popular things for the lose your tummy fat. But it's, he said this one is, you know, much more good exercise, you know, that for tummy fats. That's what it is.
최대한 무릎과 팔꿈치가 닿는다는 느낌으로 허리를 그냥 무작정 굽히는 게 아니라 복부를 최대한 수축시켜서 접어준다는 그런 느낌으로 해주세요. 누워서 하는 바이시클 크런치 자세에 서서 하는 거입니다. 네. 그 다음은 이제 두 번째 동작 크로스오버 토터치입니다. 어깨 넓이보다 살짝 넓게 발을 벌려주시고 그대로 양손은 양팔은 옆으로 나란히 그 다음에 그대로 숙이시면서 교차시키면서 발과 발.
So this kind of movement is only 1 minute. You know, 1 minute is maybe nothing, but it's hard. And then plus keep it up, you know, daily. You know, even 1 minute. You know, every day doing is very good result. And so he says whatever this motion and then go the other motion is the other video he was talking about. You know, sit up is sometimes, you know, if you have the back problem, it's gonna be hurt too. But this one is no. That's what he recommends. He says this one is very popular. And then within 1 month, if you keep doing that, and it's gonna be good result. I don't know. Yes, continuously doing is very important. Continuously.
이것도 마찬가지로 무작정 그냥 허리를 숙인다는 그런 느낌보다는 그대로 복부를 최대한
This
사용하고
one is not only
왼발, 오른발. 팔꿈치와 무릎이 닿는다는 느낌으로.
It looks very simple.
이거는 여러분들
Simple
너무
too.
보이잖아요.
The most important thing is continuously. Every day, maybe 30 days, you might get some result.
누구 뼛소리입니까 이거? 뼛소리가 자꾸 나는데 네. 옆구리 근육을 충분히 사용하면서 운동해줍니다. 그 다음은 이제 또 터치 킥입니다. 그리고 이제 서주신 상태에서 양손은 앞으로 나란히 상태에서 무릎은 최대한 펴준 상태로 발가락과 손끝이 만나게 발가락과 손끝을 최대한 닿게 한다는 느낌으로 접어줍니다. 네. 30초가 진행합니다.
This one is even 30 seconds.
핸드폰 옛날에
Not even 1
저희
minute.
때는
It's gonna
아 지금
get good result. That's what they said.
네, 핸드폰이 된 느낌이랍니다.
Okay.
재미없는 개그지만 웃어줍니다. 마지막 운동 다섯 번째 운동은 여러분의 필살 복근 터지는 필살 운동 일명 목터 목터 운동입니다. 그리고 이렇게 손이 니은자가 되도록 올려주신 상태에서 왼발부터 오른쪽 왼쪽 오른쪽 이거는 무릎을 굽히신 상태에서 그대로 크런치 하는 동작처럼
Pretty similar, movement. But if you do 30 seconds or 1 minute, total is maybe 3 to 5 minutes every day. If you do the 1 month, you're gonna get good result. That's what they said. Said, oh, I have to lose here, I have to lose here. People never really try, right? So it's, whether you don't have, the fat here, around here is always coming. So just, very simple things. Try. And they are very popular couple to do things. Okay, today we just enjoy this fun thing. Thank you very much.
Thank you.